ACL tears are most common in women's soccer and men's football because of the constant aggressive running and pivoting. There are two ways to replace a torn ACL. One is with an autograft, which is replacing the torn ligament with tissue from elsewhere in the body, and an allograft, which is replacing the torn ligament with tissue from a cadaver. Weeks 1 and 2 will work on range of motion and gradual weight bearing. Weeks 2 to 4, increasing range of motion and strength. Weeks 4 to 6, increasing range of motion and beginning upper body and core exercises. Weeks 6 to 8, intensifying weeks 4 to 6. Weeks 8 to 12, continuing strength, full range of motion, and beginning balance exercises. Weeks 12 to 14, begin lightly jogging, plyometrics, and increasing agility training as comfortable. Before we start rehab, the patient's range of motion for flexion and extension should be tested. Someone coming out of surgery will have a much more limited range of motion than this. Our first two exercises are passive knee extension, which is sitting down and setting the heel of your injured leg on another chair and relaxing your knee to try and extend as far as possible, and straight leg races, trying to lift only the leg and not the hip. Next are heel slides, focusing on keeping your butt on the ground and bringing your heel as close to you as possible. Isometric quadricep contractions, holding for about 10 seconds. These will help with activating all the muscles around the knee. Double leg calf raises. Eventually, when the patient is comfortable, they can try single leg calf raises. Riding a stationary bike for 15 minutes will help with both strengthening the legs and range of motion. To end weeks 2 to 4, we will do 4-way hip/leg raises. Strengthening the hips is ideal to have correct posture, especially after an ACL surgery. To begin weeks 4 to 6, we will start with single and double leg prone knee flexion. Then half squats, holding for about 10 seconds, and half lunges. The reason we are doing half squats and half lunges is because the knee does not have full range of motion and strength. If the patient feels they are ready, they can attempt single leg half squats holding for about 5 seconds. If they don't feel ready, they can skip. Walking stairs is good for range of motion and for strengthening the ligaments of the knee joint. Keeping your core in shape is essential after a knee surgery because you will not have normal strength in your legs, so you will have to rely on your strength of your core to compensate. Another thing that is good to do after a lower body injury is to exercise your upper body so you can keep at least one half of your body in shape. During these weeks, we will just intensify the exercises from the previous 2 weeks and focus on strengthening, achieving full range of motion, adding weight, and keeping a higher heart rate. During weeks 8 to 12, we can begin balance exercises as the patient becomes more confident. We will start with timed double leg and single leg balance disc work. Double leg and single leg med ball toss. This helps with both balance and hand-eye coordination. During weeks 8 to 12, we can also begin doing plyometrics, such as side-to-side hops and forward-to-backward hops. Next, we have prone resisted knee flexion, focusing on trying to bring your heel as close to your butt as possible, helping with both range of motion and strength. As our range of motion increases, we can begin to do full squats or the lowest you can possibly get. While doing crab walks, you want to focus on keeping your butt low and resisting the band from pulling your knees inward. Knee pronation helps build strength in your legs and knees to pivot for when the athlete is ready to return to play. At around weeks 12 to 14, we can increase the difficulty of all the previous exercises as well as beginning to jog lightly and start single leg plyometrics. such as forward and backward hops, side to side hops, and X hops. After week 14, the athlete should be ready to begin slowly returning to limited practice and doing these exercises on their own.